I want to have a conversation with you today about healthcare and what it means to Vermilion, to you and to me. As many know, I served as a paramedic for 20 years in this community and seen the impact healthcare had on our community. The struggles to keep doctors in our community, the fears of not having an ambulance when you have an emergency, or as you age, aging in place and not having supportive housing to support aging in place. These are very serious concerns, and they're concerns that impact all of us. I recently did a poll to see what our community thought was the biggest healthcare concerns. What I found was its access. Accessing the ambulance when there's an emergency and minutes matter. Accessing supportive homes as you age and your healthcare needs change. Accessing physicians as a new immigrant or resident to our community and not having a family doctor. These are all very serious concerns and they impact all of us. If elected as mayor, what I'd like to do is really work with our local MLA, our provincial leaders, and our healthcare practitioners and professionals to see how we can address some of these issues. When I think of retaining physicians and healthcare practitioners, I think it's not enough just to offer incentives or give them money. What we've seen time and time again across this province is when you offer these incentives, these health practitioners will stay for the duration of their contract. Now you might get some that stay longer, and we are very lucky to have some health practitioners stay in our community for many decades. But what we need to do is understand why they're staying. They're not staying because of incentives. They're staying because they chose to raise a family here, because they wanted to build their career and their practice here, because they had a buy-in to our community. And that's what we have to focus on when we look at retaining physicians and healthcare practitioners. We need to show them why it's valuable to live in our community. Let's talk about the ambulance for a moment. It's not acceptable at all that there's no ambulances in our community. When we look at the city and we hear about the code reds, that we've seen it on the news, there's not enough ambulances and things are done immediately. Well, when our community is without an ambulance, we are in a code red. When that person or individual needs an ambulance because they're going through an emergency, minutes matter, and we cannot rely on ambulance services coming from other communities. This is an issue we have to address. I'm excited to say I've worked with the province, with our MLA, and with health professionals to talk about this issue in the past. I want to continue that conversation and see how we ensure ambulances are in our community. So when you're having an emergency, you have the support you need. And finally, I want to talk about supportive housing. As people age, their healthcare needs change. And we've seen studies and time again about aging in place and how important it is. We need to ensure we have supportive houses and supportive services to help people age in place in their community. I've seen it firsthand where somebody's healthcare needs change and they have to leave our community, and they're born and raised here, but now they have to leave. They have to leave their loved ones, their spouses, because we can't support them. I'm excited that we have supportive housing level 4 in our community now, but we have to go further. And we need the support and the funding of the province to go further. So if you choose on October 20th to vote for me, these are the issues I'm going to bring up. And my goal is to listen to you, collaborate and work with our provincial leaders, and resolve some of these healthcare issues. Thank you. I look forward to talking to you around town. Please, if you see me, stop and bring up your concerns or your successes when it comes to healthcare. And until next time, have a great weekend.